This is the story about how I was made disabled by a thrush infection. Um, so, thrush isn't this benign condition that everyone necessarily gets. Uh, in thrush prone women, uh, or even, on the first or second, the thrush can do neurological damage to your vulva or vestibule. So, the vestibule, they don't teach at school, but or even to gynecologists or GPs. But the vestibule is the entrance of the vagina and it is packed full of nerves. And these can be really irritated by a severe thrush infection. In particular, in October 2022, on my 10th thrush infection, I got a infection that lasted 2 months instead of the usual 2 weeks. And so, yeah, this has caused, at this point, irreversible nerve damage to my vulva, and I live at about 6 or 7 out of 10 pain. It's had a pretty cataclysmic effect on my life. The summer I just took 3 months out of work because I was in so much agony, and now I only work half days because I can't really cope with the pain, and it infiltrates various aspects of my life. It's affected my sense of self. It's affected how I can earn a living. The NHS system isn't really equipped to deal with someone with my condition, so I've had to go private a lot. Like the NHS wait times for a gynecologist, even Vulvodynia, and we're looking for that like half a year, which is kind of inappropriate for the level of impact it's had on my life. It's affected my relationship, it's affected my plans for life. Like, ideally I wanted to be having a child at this point. That's up in the air because I'm struggling to look after myself. It's made me kind of severely depressed, and it's been really, really bad. And I feel like all of it could have been avoided if there was better awareness amongst people and amongst doctors that thrush is not this benign condition for a significant proportion of women, particularly the ones prone to thrush. And so, because there's no prevention and there's no help for women who are prone to it about like what it could lead to, I've just been left to kind of waste away, it feels like. I think ultimately this could have been prevented had I known. There are various ways in which you could reduce your risk of thrush. For me, one big trigger was drinking beer, a lot of beer in a small amount of time. Had I known how dangerous thrush could be, I would have stopped doing that. Also, the IUD can increase your risk of thrush because it allows biofilms to sit on the device, and so your body can't fight it. So I think that was a contributing factor to me getting the nerve damage. And it took me a long time to find a doctor who even knew about this nerve damage. They only exist as vulvar dermatologists or in vulval clinics, which, many GPs don't even know they exist. They don't know vulvar dermatologists exist. And gynecologists also sometimes don't know they exist, or I was never really directed by a gynecologist to go to a vulval clinic. They would shrug their shoulders and just be like, well, I don't know what this is. Good luck. And I felt quite alone and abandoned by the healthcare system. Once you've got the nerve damage, there's not a lot they can do for chronic pain. They have things like amitriptyline, drugs that are designed really to be antidepressants, and in some people they, do reduce the feeling of pain. But generally, even within, if you read the British Pain Society, they say these are notoriously ineffective. They only work for about kind of like 1 in 5 patients by bringing down the pain around 30%. So if you are impacted by high impact chronic pain, these aren't very good. So after that, you've only got kind of experimental stuff, like spinal cord stimulators and even intrathecal pain pumps, which are not really available in the NHS. Spinal cord stimulators are after a very, very long wait. But yeah, I wish I wasn't in this position. I wish someone had just told me that thrush is actually quite dangerous and you should take it seriously. And there are loads of ways to reduce your risk of thrush, be it through lifestyle changes or just having a competent vulval dermatologist or a vulval clinic just helping you monitor thrush levels and working in partnership with you to ensure that you don't get further repeated outbreaks. When I first got vestibulodinia, so the nerve damage, it did actually go away. And I think, like, I don't want to scare anyone, but like if this happens to you, it can just go away and get resolved. I think the key thing is you are diagnosed early so that you know, right, okay, a certain amount of damage has been done. Your nerves can heal. It takes about 2 years. And so, yeah, mine did completely heal the first time, but I was never diagnosed and I was never explained to me what has just happened and how dangerous it is and how important it is to just ensure you never get thrush again after that. So then it came back after 6 months. And then I went to see a consultant who specialised in thrush, who then said I had cytolytic vaginosis, which is a very controversial condition, which describes kind of an overgrowth of good bacteria in your vagina. And it's extremely controversial because it shouldn't really be diagnosed without ruling out vulvar pain syndromes, and a lot of gynecologists, or this particular gynecologist, had no experience in vulval pain syndromes. They don't check for hormone levels, which, you know, low levels of estrogen and progesterone and testosterone can irritate your vagina and your vulva, and you often see that in perimenopausal women and menopausal women. And so it's because the vestibule has loads of sex hormone receptors for its integrity. So, you know, first things first, you need to do like a hormone test to just make sure that you've got healthy amounts to ensure the integrity of your vulvar vestibule. And then beyond that, you need to know that thrush is highly associated with nerve damage. So this doctor didn't know about any of that and just said you have too many good bacteria in your vulva. And the problem with cytolytic vaginosis diagnosis is how much is too much good bacteria, and there is no standard definition of how much is too much. And because of that, it all comes down to consultant opinion. And so you can present to 2 different doctors and they will have 2 very different opinions. And particularly when it's a pathogen-driven condition, that's really dodgy, because really you should be able to repeat the test and have a consistent result. Yes, you got too much. Yes, you got too much. Yes, you got too much, to verify you do have too much. You can't do that with cytolytic vaginosis because it's literally just their opinion. Also, the vast majority of studies in the vaginal microbiome are biased towards white women. So it's because most of the money in research is in areas where there's an overabundance of white women. But if you look at, women of Latin American descent or even African descent, you will often see that they have more of a vaginal microbiome that looks like maybe they've got aerobic vaginitis. But it just seems how populous this is within these general populations that actually for them, that's a healthy vaginal microbiome. Again, there's too little research into what a normal vaginal microbiome is. And it makes sense that different groups of people will have different vaginal microbiomes related to the environment within which their population has kind of evolved out of. So, you know, what was the abundance of food? What kind of food were they eating that would be in harmony with their body? You know, it makes sense that different populations might have a different microbiome. So again, less than 1% of global funds go into research into women-specific conditions, despite us being 51% of the population. So, you know, this is a key example of kind of systemic medical misogyny, and everything really gearing towards men being the norm and women being a nice to have. So unfortunately, because of this misdiagnosis, which was quite humiliating, I was given a treatment plan which involved douching bicarbonate of soda up my vagina 15 times a day, 5 in the morning, 5 at lunchtime, 5 douches in the evening, and it meant that I often looked as if I've wet myself, because what goes up must go down. And I would douche, think most of it's come up, but some would go in my uterus, and then maybe like 2 hours later, boof, a load of like water would come down, and it was humiliating. And I did it for like 2 weeks, phoned the consultant secretary being like, I don't think this is right. And also I didn't really see any benefit immediately from pain. And, you know, the response was, the only women the doctor can't help are those who think they know more than them. So I shut up, because I had never been really this sick before, and I was like, no, doctor knows best, despite being on a Facebook group saying that this doctor was rubbish, and I shouldn't trust them. But, you know, following COVID and this whole anti-vax movement and this whole COVID's fake, like, I really believed in doctors, and I felt like we must trust them. But I really shouldn't have. And when the bicarbonate douching didn't work over 3 months, I said, look, my wedding's coming up. I would really love to be better. And they said, well, we can give you Augmentin. It might come back in 8 months, but we can give you Augmentin, which is a broad spectrum antibiotic to knock down your good bacteria. So I took that, and that's when I went from like 1 to 2 out of 10 pain all the way into like 5, 6, 7 out of 10 pain, because antibiotics notoriously cause thrush, and I had recurrent thrush over last summer, and whatever nerve damage was there just got a whole lot worse, which is at the point that I went and looked for second opinions, and I then got the diagnosis of nerve damage from a vulval clinic and Vulvodynia. For a long time, I really had hoped that I would make a full recovery with something called a vestibulectomy, where they cut the tissue out of the vestibule and the nerves out. And so I went to America, where they have something called a vestibule anesthesia test, where they numb up that area to see whether, if you numb those nerves, whether it helps. Fortunately for me, it didn't really get rid of any of my unprovoked pain, which is what I've got day to day. It just feels like I've got, you know, the burn they give you at school, like, feels like that. Feels like, you know, the end of a thrush infection, where, you know, the burning's still there at the entrance of the vagina. So I didn't pass that test, which shows I'm not really a great candidate for a vestibulectomy, because most likely the nerves all the way up from the vestibule into my spine the pain's been remembered, a bit like how when you play the piano you get this muscle memory. It's not muscle memory, it's nerve memory, and so that can happen with pain. And so the pain in my vestibule has gone all the way up into my spine and beyond, and that's when it becomes really, really difficult to treat, because there is no cure for chronic pain. It's all about like managing chronic pain, pacing, spoon theory, you know, lifestyle changes to minimize stress, which is all good. But when you're in a kind of disabling amount of pain, and you're crying most days wishing you weren't born, I just find it quite unhinged that we're saying to people they must accept this level of pain. So at the moment I'm on course to get a spinal cord stimulator later in the year, which I really hope I don't come to regret. These are extremely controversial as well. I think Australia is moving to ban them. All the studies on them have been done by the medical companies that are kind of manufacturing them, so they're not unbiased, they're biased. They want to sell more of these, and they're very expensive. They're like £60,000 to get privately. But it's my kind of only hope, really. At this point I've tried all the nerve drugs like amitriptyline, nortriptyline, pregabalin, gabapentin. I haven't tried actually gabapentin, but I was told, well, if pregabalin's done nothing, what's the point gabapentin? I've tried duloxetine, and I'm on lamotrigine now, which is like a bipolar one, but none of these have had any particular effect at all. The one thing that helps is ice, and I ice my vagina a lot, or vulva. So yeah, it sucks, because I was healthy and well really until 32, and now I'm in the trenches, and I've suffered a lot with like medical misogyny, and just like a lot of doctors don't know about this because they're not trained, and yeah, of the doctors that do exist that know about it, you know, the treatments, there are treatments, but they're notoriously ineffective. And I just think when you've got a condition that is this cataclysmic, you really as a health system should try and do everything you can to avoid a woman getting this. And because thrush isn't seen as sexy, thrush isn't talked about, there's a lot of stigmatism and taboo around talking about the vulva. This is a big black hole in medicine, basically. And like, even women I've met with endometriosis who also have vulval conditions like lichen sclerosis, lichen planus, they'll talk openly about endometriosis, but it takes much longer time for them to open up also about how they have these vulval issues as well. And I think it's because the vulva is like the most explicit part of the female anatomy, and because of that, you know, why would you want to be open about it? So I'm doing this because I just want to warn women. I think women have the right to know there's a link between thrush and nerve damage, and they have the right to healthcare that can prevent this from happening, and that exists in vulval clinics and with vulval dermatologists, and with, you know, people taking their health into their own hands and making significant lifestyle changes to minimise the risk of getting thrush. And I'd certainly say my tip to anyone who's had more than 5 thrush infections in a lifetime: go to a vulval clinic, discuss your you know, worry and risks, and you know, you can go to my website called www.thrush-support.com, which has loads of free information on how to reduce your risk via lifestyle changes. So yeah, that's my story in a nutshell, and I hope this helps other women out there. Thank you.